Hey, a lot of people have been recommending different countries and different places to do my surgery. And I wanted to touch on a little bit why I've selected the dentist and the surgeon that I have in Texas. Because it's a lot more complicated than just having a surgery. First of all, cavitation surgeries are highly controversial, like most alternative treatments. It takes a lot of time before they're widely accepted. And because cavitation is not widely accepted by most doctors and scientists, people like to shut it down. So there have been surgeons in Canada that practiced cavitation for 20 years, and they were told by the College of Physicians that if they continue to practice cavitation, they're going to have their license taken away from them. This is happening with all sorts of treatments, believe it or not. I spoke to a surgeon in Utah, and usually they would provide an IV vitamin C while the patient is having the surgery. And IV vitamin C is known to really speed up recovery. Well, the FDA swooped in and said that if they use IV vitamin C anymore, they're going to have their license taken away from them. It's vitamin C, guys. And they're having their license threatened to take that away from them. Like, this is crazy stuff. So this is what I'm dealing with. My situation is very nuanced and it's very complex. The virus that I have is systemic. It leads to reactive arthritis. It affects my cognitive function, my energy levels. Like, when it's really rampant through my body, I cannot function at all. And this virus is very good at hiding. So, what I'm doing with the ozone treatments is I'm actually cleaning out my blood. So when there's this virus that's present and active in my blood, it cleans it out. It wipes out all these bad microorganisms. But they have a lifeline, and they do hide in the body. So they tend to hide in the knees, they tend to hide in my wrists and my hands, and then of course in cavitation sites. And unfortunately, ozone treatments can't access this area. It needs to be cut open. The abscess needs to be removed. A biopsy needs to be taken because there's a lot more than just this 18-year-long viral infection that's going on in there. I have most likely parasites. 100% I have fungal infection going on, and then probably a host of other things. And so it needs to be cleaned out properly, not just by any surgeon who's just going to cut me open. There are many things that I need to look out for, and so here's how I vetted my surgeon. First of all, the surgeons I was looking for were people who actually practice cavitation, not just biological dentistry, but specifically cavitation. And what I needed, because my case is so severe, is I needed general sedation, and I need all 4 surgeries done in one go. I had some options in Quebec to do cavitation, but they wouldn't put me under. And not being put under means that I have to do the surgeries one at a time separately, which means my healing process could take up to 8 months, and my travel time and these multiple surgeries, which puts me at risk because I already struggle to recover with everything that's gone on in my body, especially all the drugs that I've taken for 18 years from this misdiagnosis has had a very huge negative impact on my body and has inhibited my healing process. So I'm still continuing to detox from those 18 years of drug use and damage done to my body. And the safest course of action is to do all 4 treatments, all 4 surgeries, one go. And that's because it'll be quicker, it'll be more efficient. I also don't have a lot of space in my jaw. I was born with a birth defect where half my jaw is significantly shorter than the other one. Like, this is how it looks in the scans. And so my ability to hold my mouth open for that amount of time, or to even be supporting of the surgeon while he's doing the surgery, is going to be a challenge. So general anesthesia was the main concern, and unfortunately they don't put you under here in Canada. They don't offer cavitation surgery, and the only options available in Canada was to cut all 4 areas open, do a biopsy, and heal. And then if the biopsy can prove I have residual infection, then I'll have to go in and do a secondary surgery and have all these areas cut up. No, thank you. I'm a high-risk patient. I can't even risk going through that many surgeries twice. Give me a break. The first thing is, of course, general anesthesia. The second is, once they cut me open, how are they removing this infection? So I'm looking for laser right? Laser is really important. It's going to clean out the whole area. They're going to scrape off the bone. They're going to remove all the tissue, all the necrose bone and necrose tissue, which basically is dead and rotting and infected areas. And then after that, they're going to irrigate it, which is wash it out with ozonated water. And ozone, as you know now, is just super effective at killing off microorganisms. But there's all these microcapillaries underneath the bone area. When they pull the tooth out, there's all these tiny little tubular microscopic tubes. And the bacteria likes to crawl inside these tubes and hide. So even if we irrigate the area, there's still bacteria, viruses, fungal infections, parasites hiding inside the microcapillaries underneath the bone. So after we ozonate, we irrigate with ozonated water, then I need ozone injections. And a lot of places I called didn't offer this. And this is absolutely important because it would be a waste of money and time and a lot of energy and effort to cut me open, wash it out, but sew me back up with still the virus hiding and lingering inside these microcapillaries. It's just going to wreak havoc again and re-enter my bloodstream. So the ozone injections actually injects ozone gas into the microcapillaries. The gas travels down these microcapillaries and it cleans out any hiding, lingering fungus, parasites, viral infections, bacteria, any kind of germs that are in there. It clears it out. And then they do PRF, which is super important because I did not heal up from the first time I had the surgery, and there's a few reasons why I didn't heal up. One of the reasons is because of the way my jaw is placed. There's a lot of clenching, and when there's clenching, there's no blood flow. When there's no blood flow, there's no healing. But the other reason is I was on immunosuppressants, prednisone, steroids, and a host of other biologic injections and things that really are made to suppress the immune system. When the immune system is suppressed, it cannot function and it cannot heal properly. As well, they didn't do a good job. So they left some tissue and matter in there that eventually rotted. And when something rots, bone can't grow in, tissue can't grow in, nothing can heal because there's just necrose tissue and bone and it's rotting away and there's just bacteria feeding in there. So it creates these cavitation sites. So I had a lot of things working against me. So the PRF is really taking my blood, separating the red blood cells from the white blood cells and putting in this coagulated blood tissue into the area to support healing. It's just a nice pocket of blood and nutrients and oxygen that's just tucked right into the areas, and then I'm sewn up and then my body can heal. So I didn't have this the first time I had the surgery. I didn't have the sites filled in with PRF. It's super important for me, especially given my history. And then following the surgery, they're going to be doing acupressure to support the healing, IV vitamin C, like a high dose vitamin C straight into my bloodstream. I'm so excited about that. And then a follow-up to see how things are going with x-rays and scans and all those things, imaging. So really being closely monitored here. And then I'm going to stay close to the site. So if anything does happen, given my unique circumstances, and given that I'm never the normal case, things always are a little different for me. So I'm going to stay close to the site in Texas. And if there's any issues, I'm close to this isn't something that I want to rush. It's not something I want to do cheaper. It's not something I want to be hasty about. I took my time. It took me about a month and a half to vet several surgeons. There was Quebec, there was Utah, there was Arizona, Manhattan, and Texas. And some people have mentioned Mexico, but in my searches, I didn't find anything. Maybe there's some place in Turkey, but again, it was also a question of availability. And so while I considered the place in Utah, they were only available in June. Other places, they didn't even have availability to do a phone consult with me. That's how busy they are. And so the reason why I chose Texas ultimately is because that was the first availability that had all of the treatments available, the specialized care, and the surgeon happens to be very familiar with my lifelong viral infection, while all the other surgeons had no idea about it. Based on my research, based on all the things that I vetted, the clinic in Texas has everything that I need. And it has the quickest availability, April 15th. And that's really good because this systemic infection is not something I want to prolong or delay until June. because then I'm having to prolong my ozone treatments, and ozone treatments is anywhere from $1,100 to $1,400 depending what I'm doing that week, and that's every week. And so it's not just cost, but it's time, it's my recovery, it's my life. Like I gotta do this as fast as I can. That's really important for me. And I really love that my surgeon is qualified and has found this virus in multiple cavitation sites. So he's very familiar with this infection that I've been fighting for 18 years. And that's very hopeful to me. That's really, really hopeful.